Hello, I'm Dr. James Wilson, and welcome to Senior Vitality Clinic. Today, I'm going to help you understand medication timing so you can have better conversations with your healthcare team. This information is educational and should never replace personalized medical advice from your doctor. Here's something that might surprise you. Taking your blood pressure medication at night instead of morning could reduce your risk of heart attack by up to 45%. Taking your cholesterol medication at bedtime instead of breakfast can make it work better. The time you take your medicine really does matter. Most of us focus on taking the right dose of the right medication, but we often ignore when we take it. Your body operates on a 24-hour internal clock. This clock affects how your body absorbs medications, how they work, and what side effects you might experience. Today we're going to look at what science tells us about medication timing. We'll cover common medications that many people over 60 take. We'll discuss when to take them for the best results. And most importantly, we'll talk about how to work with your doctor to create the right schedule for you. Remember, every medication schedule should be personalized. What I share today is general information to help you ask better questions. Never change when you take your medications without talking to your doctor first. Let's get started. Your body doesn't work the same way all day and night. It follows what scientists call circadian rhythms. These are 24-hour cycles that control many body functions. Your blood pressure is typically lowest during sleep. It rises in the morning. Your stomach produces more acid at night. Your liver processes cholesterol most actively in the early morning hours. Your kidneys filter waste differently throughout the day. These patterns matter for medications. A drug taken when your body is most receptive will work better. It may cause fewer side effects. It might even let you take a lower dose. This field is called chronotherapy. Research on chronotherapy has grown significantly in the past 20 years. Major medical journals have published hundreds of studies. The results are clear. Timing matters. Common misconceptions. Many people believe medication timing is just about convenience. They think the main goal is remembering to take pills. While remembering is important, that's not the whole story. Some people take all their medications at once to make it easier. This might not be the best approach. Different medications work better at different times. Others believe that take with food means any meal. But for some medications, the specific meal matters. Some work better with breakfast. Others work better with dinner. Another misconception, if you miss a morning dose, you should double up at night. This is almost never correct. It can be dangerous. Why this matters after 60. As we age, medication timing becomes even more important. Here's why. Your body processes medications differently after 60. Your liver and kidneys work more slowly. This means medications stay in your system longer. Timing them correctly can prevent buildup and reduce side effects. Many people over 60 take multiple medications. The average person over 65 takes 4 or more prescription drugs. When you take multiple medications, timing becomes more complex. Some drugs interact with each other. Taking them at different times can prevent interactions. Sleep patterns change with age. Many older adults wake up early or have trouble sleeping. Medication timing can affect sleep quality. Some medications cause drowsiness. Others can interfere with sleep. Falls are a major concern for older adults. Some medications cause dizziness or low blood pressure. Taking them at the right time can reduce fall risk. The good news, you have more control than you think. Working with your doctor to optimize medication timing can improve how you feel. It can reduce side effects. It might even improve how well your medications work. Let's look at specific medication categories. For each one, I'll explain the science behind timing recommendations. Remember, these are general guidelines. Your doctor might have specific reasons for a different schedule. Always follow your doctor's instructions. Blood pressure medications. Blood pressure follows a daily pattern. It drops during sleep and rises in the morning. For most people, blood pressure peaks in late morning or early afternoon. Recent research has changed how doctors think about blood pressure medication timing. A major study published in the European Heart Journal followed over 19,000 patients. Those who took their blood pressure medication at bedtime had significantly better outcomes. They had fewer heart attacks, strokes, and other cardiovascular events. Why does nighttime dosing help? Several reasons. First, many blood pressure medications work for about 24 hours, but their effect isn't constant. They're strongest in the first 12 hours. Taking them at night means maximum effect during sleep and morning hours. This is when blood pressure naturally rises and when most heart attacks occur. Second, nighttime dosing can reduce the morning blood pressure surge. This surge is particularly dangerous. It's associated with increased risk of stroke and heart attack. Common blood pressure medications include ACE inhibitors, ARBs, calcium channel blockers, and diuretics. Studies suggest ACE inhibitors and ARBs work particularly well when taken at bedtime. However, there's an important exception: water pills or diuretics. These make you urinate more frequently. Taking them at bedtime means multiple trips to the bathroom at night. This increases fall risk and disrupts sleep. Most doctors recommend taking diuretics in the morning or early afternoon. Talk to your doctor about your blood pressure medication schedule. Ask if bedtime dosing might be right for you. Don't change your schedule without medical guidance. Blood pressure changes can be dangerous if not monitored properly. Cholesterol medications, statins. Your liver produces most of your cholesterol at night. This is when the enzymes responsible for cholesterol production are most active. Statins work by blocking these enzymes. Taking statins at bedtime, when cholesterol production peaks, makes them more effective. This timing matters more for some statins than others. Short-acting statins like simvastatin and lovastatin should be taken at bedtime. Studies show they work significantly better with nighttime dosing. Longer-acting statins like atorvastatin and rosuvastatin can be taken any time of day. They stay in your system longer. The timing is less critical. A study in the Journal of Clinical Lipidology found that bedtime dosing of simvastatin lowered cholesterol more effectively than morning dosing. The difference was significant, about 8% more cholesterol reduction. If you take a statin, check which one you're on. Ask your pharmacist or doctor if it's short-acting or long-acting. If it's short-acting, bedtime is best. If it's long-acting, consistency matters more than specific timing. Thyroid medications. Thyroid medication requires careful timing. The most common is levothyroxine. It needs an empty stomach to work properly. Food, especially calcium and iron, interferes with absorption. Coffee can also reduce absorption. The standard recommendation is to take thyroid medication first thing in the morning. Take it at least 30 to 60 minutes before breakfast. Don't eat or drink anything except water during this time. Some people find this difficult. They want their morning coffee right away. If this is you, talk to your doctor about bedtime dosing. Recent studies show bedtime dosing can work just as well. You need to take it at least 3 to 4 hours after your last meal or snack. Make sure your stomach is empty. A study in clinical endocrinology compared morning and bedtime dosing. Both were equally effective at controlling thyroid hormone levels. The key is consistency and an empty stomach. One benefit of bedtime dosing: you might remember it better. Many people have a consistent bedtime routine. Morning routines can be more rushed and variable. Whichever time you choose, stay consistent. Take your thyroid medication at the same time every day. This keeps your hormone levels steady. Osteoporosis medications. Bisphosphonates are common medications for osteoporosis. Examples include alendronate and risdronate. These medications have strict timing requirements. You must take them first thing in the morning on an empty stomach. Take them with a full glass of plain water. Then wait at least 30 to 60 minutes before eating or drinking anything else. Here's the critical part: you must stay upright. Sit or stand for at least 30 minutes after taking the medication. Don't lie down or recline. Why such specific instructions? Bisphosphonates can irritate your esophagus. They don't absorb well with food. Following these timing rules reduces side effects and improves effectiveness. Some people find weekly dosing easier than daily. Both options exist. Talk to your doctor about what works best for your schedule. Diabetes medications. Diabetes medication timing depends on the specific drug and when you eat. Metformin, the most common diabetes medication, is usually taken with meals. Taking it with food reduces stomach upset. Some people take it once daily with dinner. Others take it twice daily with breakfast and dinner. Insulin timing is more complex. It depends on the type of insulin and your eating schedule. Rapid-acting insulin is taken right before meals. Long-acting insulin is often taken at bedtime or in the morning. Newer diabetes medications called GLP-1 agonists have different timing. Some are taken weekly, others are taken daily at any consistent time. Your blood sugar patterns throughout the day should guide medication timing. Your doctor might ask you to check blood sugar at different times. This helps determine the best medication schedule. Never adjust diabetes medication timing on your own. Changes in timing can cause dangerous blood sugar swings. Stomach acid reducers, proton pump inhibitors, PPIs, like omeprazole, are common for acid reflux and stomach ulcers. These medications work best when taken 30 to 60 minutes before your first meal of the day. This is usually breakfast. Why before breakfast? PPIs work by blocking acid-producing pumps in your stomach. These pumps are most active when you eat. Taking the medication before eating allows it to work when you need it most. Taking PPIs at bedtime is less effective. The pumps are less active during sleep. H2 blockers like famotidine work differently. They can be taken at any time. For nighttime heartburn, taking them before bed can help. Pain medications. Timing matters for pain medications, especially anti-inflammatory drugs. NSAIDs like ibuprofen should be taken with food. This reduces stomach upset. The specific meal matters less than having food in your stomach. For arthritis pain, many people find morning dosing helpful. Pain and stiffness are often worst in the morning. Taking medication at breakfast can provide relief during the most active part of your day. If you take pain medication regularly, consistency is important. Don't skip doses or change timing without talking to your doctor. Opioid pain medications have different considerations. They can cause drowsiness. Your doctor will recommend timing based on when you most need pain relief and when you need to be alert. Sleep medications. This might seem obvious, but timing matters for sleep medications too. Most sleep medications should be taken 30 to 60 minutes before bed. This gives them time to start working. Make sure you have 7-8 hours for sleep. Taking sleep medication too late can cause morning grogginess. Don't take sleep medication with alcohol or after a large meal. Both can change how the medication works. Some sleep medications work differently. Melatonin, for example, should be taken 1-2 hours before bedtime. It works with your body's natural sleep cycle. Now let's talk about how to put this information into practice. Here are concrete steps you can take. Review your current medication schedule. Make a list of all your medications. Include prescriptions, over-the-counter drugs, and supplements. Write down when you take each one. Look at this list with fresh eyes. Are you taking everything at the same time for convenience? Could adjusting timing improve how you feel? Questions to ask your doctor. At your next appointment, bring your medication list. Ask these questions. Is there a best time of day to take each of my medications? Should any of these be taken at different times from each other? Could changing when I take my medications reduce side effects? Are there any medications I'm taking at the wrong time? If I miss a dose at the scheduled time, when should I take it? Don't feel embarrassed to ask basic questions. Medication timing is complex. Your doctor should welcome these questions. They show you're taking an active role in your health. Prepare for your appointment. Bring your actual medication bottles. Sometimes the name you use isn't the official drug name. Having the bottles prevents confusion. Write down any side effects you experience and when they occur. If you feel dizzy every afternoon, that information helps your doctor adjust timing. Note any medications that are hard to remember. Your doctor might be able to switch you to once-daily versions or adjust timing to fit your routine better. Create a system for remembering. Once you have the right schedule, you need to remember it. Here are tools that help. Pill organizers are helpful. Get one with separate compartments for different times of day. Fill it once a week. Phone alarms work for many people. Set them for each medication time. Label each alarm with which medication to take. Link medications to daily activities. Take morning medications when you brush your teeth. Take evening medications when you prepare for bed. Keep medications where you'll see them at the right time. Morning medications on the bathroom counter. Evening medications on your nightstand. Track and monitor. Keep a simple log for the first few weeks after changing medication timing. Note when you take each medication. Note how you feel. This helps you and your doctor see if the new schedule is working. If you experience new symptoms after changing medication timing, call your doctor. Don't wait for your next scheduled appointment. Resources and support. Your pharmacist is an excellent resource. Pharmacists are medication experts. They can review your medication list and timing. This service is often free. Many pharmacies offer medication synchronization programs. They coordinate refills so you pick up all medications on the same day each month. This makes managing complex schedules easier. Consider asking a family member to help. They can check in with you about medications. They can help you remember appointments where you'll discuss timing. Let's recap the key points from today. Medication timing matters. Your body works differently throughout the day. Taking medications when your body is most receptive improves effectiveness and reduces side effects. Different medications have different optimal times. Many blood pressure medications work better at bedtime. Short-acting statins should be taken at night. Thyroid medication needs an empty stomach, morning or bedtime. Osteoporosis medications require morning dosing with specific instructions. Diabetes medication timing depends on your eating schedule. Stomach acid reducers work best before breakfast, but here's what matters most: individualization. Every person is different. Your specific health conditions, other medications, daily routine, and individual body chemistry all matter. What works for one person may not be right for another. So ever change your medication schedule without talking to your doctor first? Some changes can be dangerous. Blood pressure changes, blood sugar swings, and drug interactions can occur if timing isn't adjusted properly. The goal isn't perfection. The goal is working with your healthcare team to find a schedule that works for your body and your life. A medication schedule you can follow consistently is better than a theoretically perfect schedule you can't maintain. Bring your medication list to your next doctor appointment. Ask about timing. Ask about potential adjustments. Your doctor might not bring this up, but they should welcome your questions. Remember, you're not bothering your doctor by asking about medication timing. You're being an informed, engaged patient. That's exactly what good healthcare requires. This information is educational. It's meant to help you have better conversations with your healthcare team. It should never replace personalized medical advice from your doctor. Your doctor knows your complete medical history. They can make recommendations based on your specific situation. If you found this helpful, please subscribe to our channel. We create evidence-based health education for people who want to age well. We cover topics that matter for health, wellness, and longevity. Next week, we'll talk about medication side effects, which ones to worry about and which ones are normal. That's important information that every person taking medications should know. Thank you for watching. Take care of your health, work with your healthcare team, and I'll see you in the next video.